The broadcast is now starting. All attendees are in listen-only mode.
What do you have to do for news? Good afternoon, everyone. Thank you very much for joining us today on this webinar to introduce the Advanced Management Program on Health Innovation. My name is Tanya, and I'm the Sales and Marketing Executive working on this program. And I'm here with Professor James Barlow, who will just give you a short introduction of the program and take you through it. And then we'll give you the opportunity also to ask any questions that you have about the program and anything else you need to know. Hopefully it will take about maybe 20 minutes to half an hour. If you're not able to join us for all of it, we will send around a recording to everyone at the end as well. So I hope you'll be able to stay, but if you can't, then we will also send you a recording. We have plenty of people already here, so I think we'll make a start now, and then, as I said, we will take questions at the end.
And don't forget to type in your questions if you want to, using the chat facility. So good afternoon, everybody, and many thanks for joining me on the webinar about the Advanced Management Program. My name is James Barlow. I'm a Professor of Technology and Innovation Management here in the Business School at Imperial College, and I specialise in the healthcare sector. I've been working in the business school for about 14 years now, 15 years, and I've led various large-scale programs, both research and teaching, on aspects of innovation in healthcare. And I'm very pleased that we've come together with our partners in Copenhagen Business School and IESE Business School in Barcelona to put this program together on health innovation. This will be the second year we've run it, so we've learned lessons from last year. We had very good feedback from the cohort of participants last year, and we're building on that to make a really good program for this year. What I will do then is just to tell you a little bit about why I think we need a program. What is it that's driving this interest in innovation and in healthcare, and really what the backdrop in terms of the big challenges are that we're all facing. And I'll then move on to talk about the Advanced Management Program and why we think this is a unique opportunity. I'll say something about the three partner institutions, each of which is responsible for a different module. And then we'll talk about the course design. And it actually says 4 modules there. It should be 3 because we've reduced it down to 3 modules based on last year's comments. So that's the overview for this afternoon. And I don't need to spend too much time about the big challenges and the big issues that are driving a need for innovation in healthcare. We all know what those are. We have an aging society, 300 million people over 80 in the next 35 years. Huge demands being placed on health systems. We have a major problem with obesity in many countries of the world now, not just the developed parts of the world. Again, bearing down on health systems and having a huge impact on demand for healthcare services. And then we've got the big unknowns which are floating around out there, again, all of which require a response by the world's health systems. Antimicrobial resistance is particularly challenging and could cost the world $100 trillion globally by 2050 in terms of its impact on healthcare. Another unknown is climate change and healthcare. Again, we don't really know what the impact of that's going to be, but we know it's already beginning to make a difference in terms of the spread of certain diseases to parts of the world where they were previously eradicated, and the effect of heat waves on particularly on elderly people. So all those challenges are things that I'm sure you're all having to deal with. I don't know where you all come from who are listening in on the call, but it doesn't matter which country you're in. All those issues are the big backdrop to the world's health systems. And essentially, health systems in developed countries need innovation. They need new thinking. They need to understand how to create sustainable services, financially sustainable services, at a time when we've got escalating costs, mounting demand, for all those reasons I've just mentioned, resource constraints in some countries, like the UK, where we have shortages of doctors and nurses, and all the while you've got to deliver access to high quality healthcare. So that's why we need innovation and innovative thinking. And really what's, I guess, driven our interest in putting this course on is the idea that innovation is actually a problem in healthcare. It's a problem no matter which country you go, because we have this huge lag between new ideas, new technologies, new drugs, new models of care, but between the time they're created and developed and the time it takes for them to be adopted into mainstream practice. One estimate puts it at 17 years. So we know we need innovation. There's a lot of technology out there, a lot of new ideas, but there's always this huge problem in getting them taken up and adopted into practice. So that really is one key thing, I think, that is driving our interest in putting the course on. It's giving you some insight into how you deal with that gap between development and adoption of innovations into healthcare systems, and what can we do about it. And we set up the Advanced Management Program in Healthcare Innovation a year ago, or more than a year ago, in fact, and ran it for the first time last summer with support from EIT Health. And EIT Health is a pan-European program which is all about improving the speed at which new innovations get taken up into Europe's health systems, creating an ecosystem of innovation developers from different industrial sectors, pharma, medtech, digital, gluing that together with healthcare providers, funders, insurers, policymakers. And with support from EIT Health, we decided the time was right to put together this program. All three business schools, and I'll tell you a little bit more about each one of those in a moment, all three of those business schools are heavily involved in research and teaching on healthcare innovation, policy and economics. All of them have leading academics who specialize in many different aspects of innovation in healthcare, from the initial stages, trying to understand how you improve the creativity of organizations, whether it's the drug industry or medtech or healthcare providers, through to adoption and embedding innovations within healthcare organizations. People have understandings of the finance sector, policy, and so on. So we have a number of experts located within each of the three schools, all who are leading in their own particular field. We also draw on experts from healthcare sector and industry to come in and help teach on the course as appropriate. So I think there are probably no other universities in Europe who can actually offer such a wide range of expertise and cutting edge research. The other important point to make, I think, is that the program's rooted in three different European health systems, UK, Spain, and Denmark. and they're already exemplars of different models of providing healthcare from a sort of public perspective, public healthcare perspective, and by running the program in 3 different countries, you get a sort of unique insight into how some of these more generic issues around innovation management are actually being addressed in these different healthcare systems and systems with different regulations and different funding structures and so on. And if you were to hold the course just in the UK or just in Spain, you wouldn't get the same level of insight into how the health system itself makes a difference in terms of innovation processes in healthcare. So I think by coming on the course, you will get this unique insight from these 3 different countries. Let me just tell you a little bit more about the 3 institutions. IESE is based in Barcelona and was founded in 1958, so it's been around a long time. It's ranked #1 in the world for its executive education programs by the Financial Times, and it's maintained that ranking consistently for some time. IESE is a core partner in EIT Health and the EIT Health program, and is heavily involved in many different EIT Health activities. So you're getting access to a wide network of experts and potential partners across Europe through IESE's involvement in EIT Health. Just moving on to Imperial College Business School. Imperial College is one of the top 10 universities in the world, 4th best in Europe, and it's long been a global leader in science and technology. And the business school is located really at the heart of Imperial College, sitting between the science and engineering side of Imperial and the medical school, and business and policy. So the business school has always been very heavily focused on this sort of fusion between business, technology, and entrepreneurship, focused very much on practical solutions to real-world issues. Within the business school, we have a growing and dynamic healthcare innovation, economics, and policy group with some leading experts, many of whom will be involved in teaching on the program, and all of whom are working on different aspects of innovation in healthcare, whether it's from a policy perspective, pharma industry perspective, or looking at the providers of healthcare services. All will be involved in the program and delivering their expertise to you. And then Copenhagen Business School is one of our partners because it set up the first full 2-year master's program on healthcare innovation, which was launched by CBS and the University of Copenhagen. And around about 50-60 students a year go through that program. I should have said that in the Imperial College Business School, we have a big cohort of students going through the master's program on healthcare management and innovation as well. But CBS is very much focused around management and performance within the health sector, and working very closely with health sector partners to develop teaching programs that focus on how you improve performance and how you use innovation to improve performance. Again, CBS will be drawing on its faculty for teaching on the advanced management program. Last year we had 4 modules, and we've cut that back to 3 this year, but the modules are slightly longer, so it's the same length of time in total, but concentrated more into these three modules in 3 different locations, and we just feel that works better in terms of giving people an opportunity during those 4 days to get to know each other, to work together as a group and in syndicate groups, rather than doing it in 3 days. The program's designed to allow you to arrive in the morning on the first day and then leave after lunch on the second day. So depending on where you're coming from, that helps to save a bit of time and expense in terms of hotels. As I said, locating it in London, in Copenhagen and Barcelona is very useful because it gives different kinds of insight into innovation challenges in these 3 different healthcare systems. I'll talk in more detail about the individual modules in a moment, but that slide simply shows a broad overview of the program. But essentially, we mix face-to-face sessions, both formal seminars, lectures, with very interactive activities, exercises, discussions of case studies, teamwork, and so on. And we also run a number of institutional visits during the 12 days. So, for example, last year in London, we took people to the London Medicity, which is one of the bodies that's responsible for supporting local entrepreneurs and startups and getting their products taken up in the local health system more effectively. And they give us a very good insight into some of the challenges in London in doing that. We also had people from one of the academic health science networks involved in the program last year, and that's very much around creating an innovative ecosystem locally, bringing together healthcare providers and companies and other innovators. So we have these institutional site visits as well. The actual module itself is bookended by some pre-module activities. We give you a bit of reading to do, a couple of exercises to work on, and then after the modules, some follow-up work to do as well. And running across all 3 modules is the executive challenge. And I'll come back to that in a moment, but that's essentially a specific problem that you have that you want to bring to the table and work on with your peers and with mentors throughout the three modules. Just to give you a little bit more detail of each module, we kick off in London in week 1, really by looking at the strategic context. So looking very much at the big healthcare challenges that different healthcare systems are facing. So I outlined some of those at the beginning of the talk, but really trying to drill down and think about those from your own perspective. Are there any that you're facing that are unique and haven't been picked up elsewhere in our program that you want to talk about, want to look at? What are the common themes? What are the threads that all of you are facing? So we start to look at that from various perspectives, your own perspective, but also from perspective of policymakers, regulators, the funding system in healthcare, and healthcare providers as well, and industry supporting or supplying the drugs and medical devices. We also look at policy and finance. Why do we spend time looking at policy and finance? Well, none of this happens in a vacuum. All the new drugs, all the new technologies, all the new ideas, new digital solutions aren't adopted in a world that's devoid of policy and finance. So we need to think about the direction of travel in all health systems. Where is it going in the future? How do we ensure sustainable health systems? And we hope to be hearing from some policymakers about some of the cutting edge policy thinking, which everybody needs to bear in mind who's involved in healthcare. We need to think a little bit about why we need innovation, and what is it in particular in the healthcare sector. We all think we know what innovation is. It's one of those words that's frequently trotted out, but without actually much thought to what it means. And especially important, why is innovation particularly difficult in healthcare? What is it about the healthcare system typically that makes lessons from innovation management in other industries, other sectors, perhaps less applicable in the healthcare context? And then we look at we introduce the executive challenge, and that's really where you bring your own problems to the table, and you'll need to do some thinking about this before you join the first module. But we really want to try and get those challenges out onto the table in a sort of shared learning model, where we can do a bit of design thinking to try and unpack what those challenges mean, and how we start to develop some solutions around those challenges. And we have a design thinking expert who will be helping us on that. And the executive challenge will run throughout the 3 modules. So you'll be gradually refining your ideas, your solutions, right down to the 3rd module, where depending on what the solution is, what the challenge is, you may end up with some sort of business model or new form of service design or something similar. And then we have, to set up the Barcelona module, we have a session on operational excellence. What does it actually mean in a healthcare context? What does good look like from the perspective of healthcare providers? And again, that's a topic you'll be coming back to throughout the program. So that's the London module. And then in Copenhagen, it's very much focused around new solutions and the role of innovation in developing those new solutions. So we're picking up themes from London, from Imperial College, and beginning to think about how we incorporate those innovative ideas into healthcare systems. And what does it mean from different perspectives, whether you're a policymaker, provider, or somebody involved in the various aspects of the industry supply chain. Another big issue is public-private partnerships, and the way those are increasingly being used as a vehicle for collaboration and integrated care. And what does that mean for innovation in healthcare? Key point here is that PPPs, various integrated care models, really all about sharing risk and reward, which is one of the reasons why innovation is actually very difficult in healthcare. So we need to understand something about where healthcare systems are heading in terms of greater integration across the silos, and how that can be used to actually drive innovation. Digital health, digitalization, big data, small data, social analytics, all of that is a very important backdrop to conversations about the future of healthcare. What does it mean? Again, we talk a lot about big data without really pinning down what it means and how it might help drive improvement in healthcare services. So we look at that. And how do we know whether innovation is making a difference? How do we measure performance? How do we understand the impact that innovative interventions in healthcare systems are actually making, particularly when you have very complex innovations where many things are changing at the same time, and you can't do a nice, simple, neat, randomized controlled trial. So you need to know what difference you're making, and you need to know how to do that if you're going to develop a good understanding of the impact of innovative solutions. And then finally, in Barcelona, the focus is very much on implementation, getting things done. The healthcare world is bedeviled with small-scale pilot projects, innovation projects, which end up going nowhere. Getting things done at scale and embedding innovations in the healthcare system or in healthcare organizations in a way that they can be sustained and they don't fall apart when the bit of pump priming funding ends is a huge problem for healthcare, and one which we're now beginning to develop much better understanding about how you move really from pilot project to mainstream implementation. So we need to look at some of the latest thinking around that. We also need to think about balancing incremental innovation and continuous improvement with breakthrough innovation and step changes in healthcare provision. How do you ensure that you're continuously improving, but you're capable of identifying what the potential breakthrough radical challenges are, and then managing those challenges and possibly introducing them into your organization. Teamwork, stakeholder engagement, collaboration I've mentioned just now. we need to understand how we collaborate better in healthcare, where you have excuse me, where you have a very fragmented system, usually with many silos, many different stakeholders. And one reason why innovation is so difficult is that bringing people together into some sort of collaborative model is often extremely difficult. So what lessons can we learn from successful organizations that have managed to do this? What is the role of project management for implementing strategic innovation and new strategies? And then, as I mentioned just now, the executive challenge comes to a close, culminating with you presenting your ideas, your solutions, and getting feedback on that. I should say that the modules are still being designed at the moment, and we need to refine the content a bit, and perhaps think about the flow between modules as well. So what I've given you is an illustration of the, broadly speaking, the kind of content that you will find in each of the 3 weeks, but it may vary slightly. As far as participants are concerned, last year we had around 20, I think it was, maybe about 22, Tanya, senior managers from a range of different backgrounds in the healthcare sector, largely from across Europe, but one, I think, from the US. And drawn really from a range of different backgrounds, from the healthcare provider side, both in the public and private sector, from the supply chain, from pharma, medtech, and then from regional or national healthcare planning authorities as well, and a few consultants. So we had a wide range of people, which was great because it allowed us to have the full range of perspectives brought to the table in each of the modules. And I think people learned a lot from each other, and just simply being exposed to the view of pharma, for example, on a particular problem, or the view of regional planning authorities on the same problem, gave people a very good insight into how those challenges are addressed and viewed by different people working within the healthcare sector. How to apply? It's fairly straightforward. You submit your online application. We review it. We give you pretty quick feedback. I think that, Tanya, it's just a matter of days, isn't it? And then you complete the sponsorship or executive form, and then we send out the joining instructions. It's a fairly straightforward process. As I said, we give you some pre-work to do, just to prepare you for the first module, and you'll get that about a month or so before the program is due to start. So I think that's pretty well all I've got to say at the moment. So thanks very much for listening. I'm sure we have a few questions, so please feel free to ask some questions.
Yes, hello everyone, this is Tanya again. We don't have any questions so far, so now is the opportunity to either type them into the chat box on your panel, or if you raise your hand, I can also unmute you, so you can speak and ask your question for real, rather than just type them in. We'll probably wait for another couple of minutes just to allow you to collect your thoughts, and then we will close the webinar. So if you do want to ask any questions, then now is your opportunity.
Well, I think if there are any questions as well, which you think of subsequently, then we're very happy to answer those by email or phone.
Yeah, so you have my contact details, and then if there's anything more specific you want to address to James, then please email me, and then I can pass it on as well.
Sorry.
You raised your hand.
Yes,
yes. I don't know if you can you hear us?
I can hear you. Can you hear me?
Yes. If you have a question, then please go ahead.
Yes, indeed. So typically from pharma, what sort of roles did you have attending last year?
I'll have to check that, but from memory, it was mainly from business development, the sort of strategic and business development side of pharma. but I can check the details.
Right. Okay. Yeah, that would be interesting, please.
Are you working in this industry? Are you working in pharma or?
Yes, in pharma, sort of primarily involved in joint working programs.
When you say joint working programs, that's what with on
So,
the development
yes.
side.
No, so basically, I guess you might be familiar with the joint working framework under which pharma and NHS collaborate to develop projects designed to improve outcomes for patients.
Okay. Yeah. Yes. Yeah. Well, that I think that would fit very neatly into the scope of the program.
Right.
Because we are, we do look at ways of speeding up the development process and getting ideas adopted faster.
Right. Okay. Thank you.
Okay.
Anybody else?
Let me just have a look. Tony, does that answer your? I mean, we can follow up on the exact. I can have a look through the list from last year, and I can get back to you with more specifics if that helps you.
Yeah,
because I'd be very interested in the participants from, health systems.
Yeah, obviously, I mean, yeah.
Yes, on the health system side, we had people who were, the American persons from Kaiser Permanente. And then we had people from Denmark in the I think they were more on the social care side,
right.
focusing very much on an aging population and how we integrate health and social care more effectively.
Sure.
We had several people from Irish hospital systems. 3, I think, who were all involved in rethinking care provision
right.
within their own local health system.
Sure.
I mean, broadly speaking, people were on the program because they wanted to know about the future. That they were aware of the big challenges coming up. They knew they needed to be innovative and thinking about new models of care, and they wanted the program to give them a sort of quick insight into what they ought to be doing going forward.
Right. Okay. Okay. Excellent. Thank you.
Okay. Thanks, Tony. I can't see anyone else with any questions, so I think we will conclude the webinar. And if, as James mentioned, if anybody does have any more then questions, just get in touch with us by email.
Thank you, everybody. Thanks for listening. Okay, we're going to close the webinar down now. So thanks a lot, and we do hope to see you in a few months' time. Thank you.